Did you know testicular cancer is the most common cancer among young men aged 15 to 35? It doesn't get talked about nearly as often as it should, which is exactly why we need to talk about it. Today we go into the 9 most common symptoms that may be a warning sign of testicular cancer. Testicular cancer is one of the most treatable forms of cancer, if caught early. In fact, the 5-year survival rate is over 95% for early-stage cases. Even when it spreads, treatments like surgery, radiation, and chemotherapy are often highly effective. But the key? Not waiting. If you feel something unusual, a lump, swelling, aching, or even just a sense that something's off, don't brush it off. Getting checked early can make all the difference. But first, let's understand how this develops in the body and what may put you at risk. Testicular cancer occurs when cells in one or both testicles begin to grow uncontrollably. These abnormal cells can form tumors and, if left untreated, spread to other parts of the body through the lymphatic system. There are 2 main types of testicular cancer. Seminomas. These grow slowly and are highly responsive to radiation therapy. Non-seminomas. These tend to grow faster but respond well to chemotherapy. Understanding which type you might have is crucial for treatment planning, but that's something only a qualified healthcare professional can determine through proper testing and examination. This video is for informational and educational purposes only and is not intended to replace professional medical advice, diagnosis, or treatment. Do not attempt to self-diagnose based on the content of this video. Always consult a qualified healthcare professional before making any decisions about your health, treatment plan, or lifestyle changes. What causes testicular cancer? Experts still don't know exactly why certain cells become cancerous, but some risk factors are linked to it. Undescended testicle, also called cryptorchidism. An undescended testicle means one or both testicles didn't move down into the scrotum before birth. This condition increases the risk of developing testicular cancer by 3 to 5 times later in life. Family history. If your father or brother had testicular cancer, your risk is higher, about 4 to 6 times the average risk. Age. Most common in males aged 15 to 35, though it can occur at any age. According to data from the American Cancer Society, testicular cancer is more common in white men than in men of other racial or ethnic groups. The reasons aren't fully understood, but researchers believe genetics and environmental factors may play a role. Still, many men who get testicular cancer have no known risk factors at all. That's why awareness and early detection are so important, and why regular checkups with healthcare professionals are essential, regardless of your risk profile. Now let's break down the warning signs and symptoms, and what they could mean. Sign number 1, a lump or enlargement in either testicle. This is the most common and most obvious sign. You might feel a lump that's painless, or one testicle might feel noticeably larger or firmer than the other. Sometimes it's about the texture, not just the size. If one feels hard or heavier than usual, don't ignore it. Many men discover these changes during a shower or while changing clothes. If you notice something different, see a doctor right away. Remember, normal testicles should feel smooth and somewhat firm, like a hard-boiled egg without the shell. Sign number 2, a feeling of heaviness in the scrotum. Even without a noticeable lump, you might feel like your scrotum is unusually heavy or dragging. This sensation can build over time and is often dismissed as nothing. But if that heavy feeling sticks around or gets worse, it could be an early symptom of a developing tumor. Sign number 3, a dull ache in the groin or lower abdomen. This one can sneak up on you. A persistent ache or discomfort in the groin, lower stomach, or testicles may be a sign of cancer spreading or causing irritation to surrounding tissue. It's easy to chalk it up to physical activity, muscle strain, or stress. But if it doesn't go away in a few days, it's worth investigating. Sign number 4, sudden fluid buildup in the scrotum. If you suddenly notice swelling or an accumulation of fluid in your scrotum, pay attention. This might look like your scrotum is puffier than usual or feel like there's extra weight there. This can sometimes happen as a response to inflammation around a tumor. Any sudden change in size or feel of the testicles should be taken seriously. Sign number 5, pain or discomfort in the testicle or scrotum. While many cases of testicular cancer are painless, about 1 in 5 men will experience pain or tenderness. It might feel like a sharp, sudden pain, a dull, persistent ache, or even tenderness when touched. This pain might come and go, or remain constant. Don't ignore it or wait for it to get worse. Cancer often grows silently. Sign number 6. Here's a less obvious one. Back pain or abdominal pain. Pain in your back, flank, or stomach area. Why? Because as testicular cancer spreads, it can reach the lymph nodes in the abdomen or lower spine. In some cases, men notice persistent lower back discomfort before any scrotal symptoms appear. If your back pain has no clear cause and persists for more than a couple of weeks, bring it up with your doctor. Sign number 7. Breast tenderness or growth. Even more surprisingly, testicular tumors can produce hormones that affect breast tissue. This may lead to swollen or tender nipples, breast growth or puffiness on one or both sides. It's not common, but it happens. And it's a subtle sign many men overlook or feel embarrassed about. There's no shame in it. It's your body's way of flagging something's off. Sign number 8. Fatigue or unexplained weight loss. Cancer, especially when it begins to spread, can cause systemic symptoms like ongoing tiredness, loss of energy, sudden, unintentional weight loss, loss of appetite or motivation. Many men attribute this to stress, aging, or poor sleep. But if it's paired with any of the symptoms above, it's time to see a doctor. Sign number 9. A sudden change in how one testicle hangs. This might sound small, but position and symmetry matter. If one testicle suddenly hangs much lower than the other, or feels like it's being pulled down, it could signal a change in weight or internal mass. Subtle shifts like this can be one of the earliest signs that something is developing, even before any lump is felt. Being aware of your body and any changes is important, but it's crucial to understand that only qualified healthcare professionals can properly assess what is normal or abnormal. Basic awareness techniques often mentioned include checking during or after a warm shower when the skin is relaxed, gently examining each testicle for any changes in size, shape, or texture, being aware of any new lumps, swelling, or areas of tenderness, not just in the groin area. When testicular cancer spreads, it often travels through the lymphatic system, leading to lumps in areas like the abdomen, lower back, or even the neck, particularly above the collarbone. Noting any feelings of heaviness or discomfort. However, we strongly emphasize that only trained medical professionals can accurately distinguish between normal anatomy and potential concerns. Self-assessment cannot replace professional evaluation. Any perceived changes or concerns should be promptly discussed with a healthcare professional rather than self-diagnosed. What feels abnormal to you may be completely normal, or vice versa. The most important thing is to seek professional medical advice if you notice anything that concerns you or feels different. See a doctor immediately if you notice any of the symptoms we have talked about. Don't wait, don't second-guess yourself, and don't worry about feeling embarrassed. Doctors are trained to spot the difference between harmless conditions and something more serious. Most of the time, it's nothing, but if it is something, catching it early gives you the best possible outcome. What to expect at your appointment. Your doctor will likely perform a physical examination, ask about your medical history, and may order additional tests such as ultrasound of the scrotum, blood tests to check for tumor markers, and CT scans if cancer is suspected. Now here's something unusual. You may have heard the internet rumor that a man taking a pregnancy test and getting a positive result could actually be a sign of testicular cancer. It sounds bizarre, but there's actually a little bit of science behind it. Most pregnancy tests detect a hormone called HCG, human chorionic gonadotropin. Certain types of testicular cancer, especially non-seminomas, can also produce HCG. So, in rare cases, men with testicular tumors might have elevated HCG levels, enough to trigger a positive result on a pregnancy test. But let's be absolutely clear, this is not a diagnostic method. A false positive can occur for other reasons. Many types of testicular cancer don't produce HCG at all, and this method should never replace proper medical evaluation. So while this could be an interesting red flag, it's absolutely not a substitute for proper medical assessment. If you ever suspect something's wrong, talk to your doctor. That's the only way to know for sure. Let's address the elephant in the room. Many men avoid seeking medical care, even when they know something's wrong. Common barriers include embarrassment. Remember, doctors examine people regularly. It's routine for them. Fear. Letting fear or uncertainty delay a checkup can make it harder to catch health issues early, and early action often makes a big difference. Stoicism, the tough it out mentality. Time constraints. Your health is worth more than any meeting or deadline. Healthcare professionals are trained to handle these situations with professionalism and compassion. They've seen it all, and their only concern is your health and well-being. Testicular cancer is treatable. Healthcare professionals are your partners in maintaining your health, and early intervention can mean the difference between a minor procedure and extensive treatment. Your life is worth more than any embarrassment or inconvenience. Take charge of your health today. Awareness saves lives, and open conversations about men's health can break down the barriers that prevent early detection. Stay safe, stay strong, and most importantly, stay connected with healthcare professionals who can help you maintain your health for years to come.